So for those who are not familiar with We Act for Environmental Justice, we are a community-based environmental justice organization that serves predominantly Black and Latino communities in Upper Manhattan, in New York. And we are here today to share more about this work in the beauty justice movement again and how we engage the Harlem community in this work. Next slide, please.
Yes, everyone can people see the slides? Just want to make sure before we
we can
start.
see.
Great. Awesome.
So We Act's mission is to build healthy communities by ensuring that people of color and or low-income residents participate meaningfully in the creation of sound and fair environmental health and protection policies and practices. So overall, We Act really envisions a community that has informed and engaged residents who participate fully in decision-making on key issues that impact their health and community, strong and equal environmental protections, and increased environmental health through community-based participatory research and evidence-based campaigns. A few of our focus areas include clean air, climate justice, healthy homes, which includes work around lead and pesticide awareness, sustainable land use, affordable and equitable transit, open and green spaces, waste, pests and pesticide reduction, toxic-free products, and beauty justice, food justice, and water quality. We have a few departments, the federal policy, state policy, federal policy and policy teams. We also have our organizing teams, workforce development, education and environmental health, and we also do a lot of work. We do a lot of research across all these departments.
So Danielle and I are both on the environmental health team and here at We Act, and we primarily work on our beauty justice work. This campaign, the Beauty Inside Out campaign, started in 2019, and through workshops, webinars, policy advocacy, community action, and community-based participatory research, this campaign has helped educate the Northern Manhattan community about the potential harms of personal care products, and also helped protect these communities through regulatory change. And we find it very important here in our beauty justice work to first recognize that the problem of toxins and chemicals poses a dual harm to vulnerable communities. Not only do the toxic ingredients in personal care products pose life-threatening, at times, health issues to users, but Eurocentric beauty standards and the targeted racialized marketing of toxic beauty products often harm the mental health and self-esteem, especially of women of color, and in turn harm our society as a whole. And so recognizing the two ways in which this problem manifests, we also see it's important to address this issue from the top down and the bottom up. So I understand that you all kind of work quite a bit with legislation and trying to advocate for stronger legislation around toxins and products, which is incredibly important. But we think that as long as the demand for these products remains, people will continue to find a way to use them in some way. And also addressing the root causes of these issues through bottom-up solutions is the only way to truly create change in our communities. So not only do we do top-down work regarding legislation, but also bottom-up solutions focused on targeting the demand of products and just kind of creating discussions around beauty standards and how that affects people's choices. So in 2023, or starting in 2020, We Act conducted a survey of women and femme-identifying individuals, individuals of color in Northern Manhattan. We saw this prevalent issue of skin lightening product use and chemical hair straightener use in our community, and partnered with some different public health schools, including Yale Yale School of Public Health, George Washington University, and Columbia University to create this survey to more closely identify not only how how frequently people were using these products, but also the reasoning behind why they use these products. Um, and we, surveyed a diverse array of respondents in Northern Manhattan and the Bronx, again, to understand the drivers behind their use. And we have just some quick results here that show that 25% of survey respondents use skin lightening products in their lifetimes, and 44% of respondents reported using chemical straighteners. And you all may know, but oftentimes, most often, skin lightening products contain mercury, while chemical straighteners contain formaldehyde. So these are really toxic products that, again, are influenced by the demand for them is influenced by Eurocentric and Western beauty standards. And this was really proven in the respondents of our survey that we basically showed that people's perceptions of themselves or and the goal to achieve a certain a standard of beauty, sorry, was the top reported reason why people use these products. So from this, it was very clear again that um, the that racialized beauty norms impact people's decisions to use these harmful products. And um, again, attacking these problems from the bottom up is just as necessary as attacking them from the top down. Um, so that's just a bit of an intro into a bit of the work we've done in the past. And this kind of overviews our current work in the beauty justice space. Um, so, related to the study I just talked about, we've done some product testing for mercury and skin lightening products. And we also are working on publishing a few reports about this. We're actually collating the largest data set on mercury and skin lightening products, where a few state agencies around the country and other NGOs have tested these products for mercury, found tons of mercury in them, and we are trying to create the message that this is a worldwide pervasive problem and needs to be dealt with. Um, we are also we will be testing common hair and makeup products for formaldehyde and formaldehyde releasers soon in the summer. We also do work with our community members directly through our Healthy Homes Working Group. This is an opportunity for community members to get more involved in the work we do. So this, of course, focuses a lot on beauty justice, but we also touch on pesticide awareness, lead awareness, and we're working on spreading our engagement across youth and salon workers. And again, related to legislation, in 2022, we're trying very hard with other uh, other groups to pass the Mercury out of cosmetics bill, which bans this sale of mercury added cosmetics, which, as you can see, is very important. And currently, we are working on passing the Beauty Justice Act, which bans mercury and other harmful chemicals out of beauty products. And this year, also successfully, we have passed the Toxins in Menstrual Products Act, which similarly will get heavy metals and PFAS out of menstrual products. So that's very exciting that's passed, and we're just waiting for the governor to sign it. So I'm going to pass it to Danielle to start talking about the specific project we conducted that very accurately demonstrates how we conduct community-based participatory research, as this seems like something you all are interested to learn more about. So we're going to kind of go through the steps of this project that was conducted, just finished in the summer. And then after that, we will have some time for questions about, our work and this project specifically. Sorry if we're going quickly, but we just want to make sure we have time for all of that.
Thank you, May, for providing a really great overview of our past work on beauty justice and our ongoing work. So we're here to talk a little bit more today about All Shades Are Worthy, Connecting Colorism, Skin Lightening Products, and Your Health, which was a Train the Trainer program and presentation that we conducted with the support of the FDA Office of Minority Health and Health Equity Office and in collaboration with Columbia University and other local community-based organizations in Northern Manhattan and the South Bronx. And this project really sought to develop evidence-based education materials and culturally specific dissemination strategies in order to really increase awareness on the use of and the potential risks from skin lightening products among vulnerable and underserved communities. So, as a result of the preliminary Beauty Inside Out survey, we learned that an important driver of using skin lighteners has to do with this socialization around beauty standards rooted in white supremacy and colorism. And in order to tackle the issue of skin lightener use in our community, we needed to foster community awareness and hold spaces to have difficult conversations about these issues. Therefore, we decided to engage with our community by implementing a Train the Trainer program with local CBOs. Specifically, that we worked with Columbia and the CBOs to create educational materials that covered not only the toxicity of skin lighteners in terms of biological harm, but we also created a space for discussing racism and colorism in the beauty industry and worked with these CBOs to foster a safe space for these difficult conversations around social norms and beauty standards. So with the support of our Columbia partners, we drafted these educational materials that were designed to be a 1-hour workshop highlighting background information about skin lighteners and their dangers, how to avoid potentially toxic products while shopping, and how to have conversations within your community about them. After our first draft, we worked with every community group individually to review those materials and get feedback from them. And this insight was very instrumental in guiding our efforts to better meet the needs of those that we served. An important point of feedback was to adjust the presentation for each of the community group with images that were relevant to each community. So so we worked with SAPNA, which is a CBO that works with majority South Asian immigrant women, the Dominican Women's Development Services, which is a CBO that primarily serves Latin American and Caribbean women, and the African Services Committee, which serve folks in the African diaspora. So we co-created these culturally adaptive presentations, as you can see here in these images, and we altered each of the presentations with language accessibility as well. So we have the presentations translated into French, Bengali, and Spanish to better suit the needs of those communities and to make sure that it was extremely accessible to those folks. So for example, in the Sapna NYC images, you can see that we changed the different images to fit folks from their community, which is majority Muslim. And we have the African Services Committee in French, and a lot of the imagery was changed for the African Services Committee as well. And we'll follow up on this later, but you can find all of these presentations actively on our website as well, free to access for folks who want to access this material. And yeah, next slide, and passing it on to May.
Yeah, so from there, once the educational materials were kind of solidified for each group, we held multiple training sessions where our staff kind of gave the presentations to the staff of each community-based organization, demonstrated how to teach about this content. And the first training session, people were just seeing the content, getting to understand it. But then we had subsequent training sessions where the CBO staff members would then be able to practice delivering the content get some feedback and support from us at WeAct to just be able to communicate this material as successfully as possible. So then from there, the CBOs, got together with their communities and did these trainings. They were held in-person events in June and July of 2024. We also provided each CBO with customized flyers and social media materials to spread the word about the event and to be accessible and appropriate for each of their communities. And because these organizations serve communities where English might be of a second language, each material was translated again into the appropriate language for their members. And overall, across all of the CBOs we worked with, trainings were given to 100 people. So then after these trainings were held, a staff member from each community-based organization completed a survey that was administrated by our collaborators at Columbia. And the survey gathered feedback on the train the trainer process and how the material was received by the attendees of the trainings. And so all 3 staff members from these 3 organizations felt, first of all, prepared to lead the workshops after WeAct's training. We also learned that one staff member found the section about how skin lightening products use in communities of color is an environmental injustice a bit challenging to present. So, these are pretty complex. These can be complex ideas and connections people are drawing. But overall, no one reported that there were any major difficulties with the rest of the material. And they reported that the sections most well received by attendees were that about the history of colorism, health hazards of toxic chemicals and products, and also just tips on how to shop better for your health. Finally, the CBO staff reported that they would use these educational materials again with more community members, expanding that more to men and children. Further, in the follow-up conversations of these with the staff of these workshops, they all reported that community members found the training valuable and they properly learned about the risks of skin lightening products. They said attendees were highly engaged, asked a lot of questions that suggested our materials were indeed tailored to the community. And as the kind of last step in this project, as Danielle mentioned, we have posted all of these materials on our website. We have, I think she'll drop the link in the chat, but we also have a few other just like one-pagers about skin lightening product use and other products in general. And we did this to, continue engagement with diverse communities, make these resources accessible for anyone who might be able to use them. Yeah, so now I'll go to Danielle and we'll just kind of briefly talk about some takeaways from this project.
Yeah, so some of the few takeaways that we had were to reduce the use of jargon when it comes to toxic chemicals and associated health effects, because a lot of community members are not familiar with these chemicals, so it might not mean much to them on the initial and as well as they might just not be aware of it. So the CBO suggestions were to use more simplified language and images to depict key messages. And these were strong suggestions that really strengthened our educational materials. It is very easy to fall into using technical jargon when describing these health impacts, so we needed to come up with ways to speak about these things in a very relatable and accessible manner. We also acknowledge that even for community-based organizations that are serving in a community of color, that not all communities of color are a monolith. So it was really crucial for us to have expertise with cultural nuance when it comes to doing environmental justice work and scientific communication within these communities. We must acknowledge that the topics we discussed are highly sensitive, such as colorism, white supremacy, and health. Again, going back to fostering a safe space, that was really important for us when working with CBOs to ensure that folks were able to handle these conversations that might continue to like disrupt mental and emotional health in these moments of reflection and continued discussion about these. So, for example, one of the largest problems with toxic chemicals in skin lighteners is reproductive toxicity. So, when discussing the sensitive topics such as reproductive justice and environmental justice, the messaging really must be delivered by trusted community members. So, hence why we have this Train the Trader program. It is really important to engage with them, these CBOs from the beginning, and making sure they understand the entire um, Train the Trainer process, as well as the co-creation of these educational materials, so that there are no blind spots. And although the trainer model is time and energy intensive, it is really important to is really invaluable for co-developing these culturally relevant educational materials. And the co-development and co-ownership of these educational materials and training ensures that trainers can be these trusted voices within their communities to share this messaging, and enhances these effectiveness through the cultural relevance. As we shared, these presentations were highly tailored to reflect the images and languages of each community. So there's a strong value that lies in the nuanced cultural expertise external community-based organizations bring to us as a CBO at We Act for Environmental Justice, rather than simply expanding reach and doing more of a top-down approach.
Thanks, Danielle. So yeah, we hope that was helpful in kind of going through an example process of how to meaningfully and appropriately engage with community. But we kind of have just these few points to consider when engaging with community. So from the beginning of a project, from its inception and its planning, it's good to think about first, is this work relevant and of interest to the community? Um, and second, can this work be co-developed with the community? Because the more you're able to engage community from the beginning to the end of a project, the better it is. You know, at React, we sometimes see, researchers or other partners who kind of engage with us just to check a box to say, we did community engagement. But that's really, it can be quite extractive. And so this point of co-creation and co-development, co-ownership of a project is really important, so that are serving the community's best interests. So those two questions are kind of focused on, like, as you're developing in the beginning of a project. And then, as we touched on through this example, is this engagement culturally relevant and language accessible? That's super important, for, just the effectiveness of whatever engagement you're doing. And finally, regarding the outcomes of a project, it's important to think about how will the outcomes of this engagement benefit the community. As I said, extractive engagement is common, and an easy way to, or one way to avoid this is to make sure that whatever you're doing benefits the community in some way. And especially if you're able to, get feedback and work on your engagement as a kind of living back and forth between the people you're trying to help and your organization. These are kind of just some things to think about. So yeah, we'll pause for questions now, and I see some. We'll start with the ones in the chat, and then maybe people can start to unmute. First, when I see from Jean Waters is, do you try to use community-based social marketing principles to change community norms? Danielle, do you want to briefly talk about the like social media campaign we're trying to do? Maybe that seems like the most relevant to this
Yeah, so
question.
we given like community-based social marketing principles, I think one big setback also with this train the trainer program is that we were having some issues with the IRB in terms of including community members. Um, uh-oh, sorry, my internet stalled for a second. Um, we were not able to get feedback from community members, only from the trainers themselves, because it was sort of an undue burden on the community members to onboard everyone onto our process. So this is something that we want to note for the future. So unfortunately, we weren't really able to survey the community members themselves, but we're able to talk to the trainers about how folks felt. And I think some folks, some of the examples in the moment, I guess, like anecdotally, were some people sharing that the images in the presentation reflected skin lighteners um, and products that they had been familiar with. I think most of the community members were very familiar with these products and could name folks that use them. And another source of feedback that they shared is I think some of those community members also even brought those products back to ask for further support with testing. But we definitely plan to conduct more outreach and think about this community-based social marketing principles to really change the community norms foundationally rather than just through incentive educational programs.
Awesome. Next question, also from Jean. Were you able to hear language used by your target audience, perhaps in anecdotal conversations or through the surveys, that you could then echo back to the target audience? So I don't think we've, collected this type of information formally in the way of surveys, but this is, one reason why partnering with other community-based organizations who are familiar with the communities we're trying to work with is very important because they have that knowledge and they were able to conduct the trainings in a way that may respond to these different linguistic and just like differences in how people talk about these issues. Yeah, I don't know if you have anything to add for that, Danielle, but I don't think it's more so been by way of who we engage with and how, rather than doing a more formal collection of this information.
Yeah, for sure. We really relied on working with our community partners to be able to disseminate that information whichever ways they felt were the most culturally appropriate for their group. We hadn't previously worked with their community members directly. It was best to partner with them. So the next question we have is, did your follow-up include data about how often trainers gave the training or any community changes in community purchasing habits, health outcomes, and anything similar? So again, we did have a setback of not being able to collect more data from our community members and more of a report, more of the results on their end. But the Train the Trainer program and these events occurred in June and July of 2024, and these groups also expressed that they wanted to do more of these events in the future, whether they were on skin lighteners or other topics as well. But SAPNA had 24 women attending the event, DWDC had 12 women, and African Services Committee had 71 attendees. So we had over 100 attendees, also including men, in this attending our events.
Yeah, so we weren't able to have specific numbers about, the direct outcomes of the event. But overall, it was positive feedback. So we very much hope that, people conducted change in their lives. How the next question I see is from Nini. How did you tailor the training to ensure it met the needs of the affected communities? Um, Again, this was mostly done through our collaborations with other CBOs, but I can maybe pull up one of the um, presentations as an example, and we can kind of show how differences were um, incorporated. Give me one sec. Okay. Sharing my screen again. So this is the English presentation co-created with the African Services community. And we can just quickly scroll through. As Danielle mentioned, we included different images the um, based on the organization we were working with. Um, and you can see we kind of went through health effects, tips when shopping, um, and then we kind of talked about the environmental racism aspect of this work. Um, and kind of see how we just start talking about how beauty standards and um, how to approach this issue through that lens. And then I'll pull up this other version. So you can see the images are a little bit different. Still talk about shopping tips. And even these slides about beauty standards. So this presentation was with the Dominican Women's Development Center, and you can see like how they talked about um, racism in the beauty industry in our beauty standards is a bit different than how we looked at it with the African Services Committee. So let me make sure I'm answering your question. Yeah, let me know. Those kind of more specifically just go into the nuances of the presentations. But let me know if you have follow-up questions or anything more specifically you'd like to know in this area. And then I see Holly Davies has a question about mercury in cosmetics. And I can also kind of talk on this point. So yes, we worked with the FDA for this project, but the way that these products are regulated through the FDA is through a slightly different department. And we have some colleagues at state agencies who have been trying to contact and advocate for the FDA to more dutifully enforce import restrictions on mercury in products. But it's just something that has been incredibly difficult. Our colleagues talk to one person about this, they get redirected to another person, and then changes in administration have also posed challenges to getting the FDA to do as they kind of do as they should in this sense. So I can definitely say that unfortunately mercury in products is still quite prevalent in the US, despite having international, national, and local regulations on this issue. Maybe if we have time at the end, I can talk a little bit more about this and um, findings from a convening we held in August, where we brought together experts, advocates, and and state agencies to talk about this issue and how to better protect people from mercury and skin lining products. I'm just looking at the rest of the chat.
So is it primarily different images? Did you change wording, or did you change wording to make it culturally relevant? Sorry, I've been saying culturally a lot in this presentation. So I think primarily a lot of our cultural adaptations were based on these different imagery so that people could be able to reflect and have a sense of belonging and understand, because again, I mentioned that many of these people are already familiar with these skin lightening products. So just reflecting images of their own community, using those products would only serve to reinforce the urgency and like relatability for these folks. So in terms of wording, just as May showed before in the presentation, it was pretty contextual. So discussing racism and colorism in different ways was basically changing the wording. So those ending slides, I can also share. May, do you mind pulling up Sapna's presentation?
Yes.
So in Sapna's presentation, those end slides where it talks about racism and colorism, we had different images that made note of these different beauty standards and racism in the media to kind of reinforce those culturally relevant ideas of what beauty justice and Eurocentric beauty standards could look like. So those are those are our major adaptations. And again, lastly, language is really key to reaching our audiences. So those are the main cultural adaptations that we've made.
Yeah, and I think once we had created this like the first draft version of this presentation with Columbia, and then subsequently like edited it in collaboration with the CBOs. That's mostly where language was changed, but overall, all of the presentations I think we again made sure that it was relatively like simple, understandable, digestible language. So the content didn't necessarily need to change as much as the way it was presented and the language in which it was presented in, if that makes sense. And I see Keith has their hand up.
I do. Greetings, everyone. Wonderful job, me and Danielle. Great presentation on a lot of work you all did. Um, Community engagement and legacy are powerful themes, especially when it comes to movements like you're all doing around beauty justice, um, environmental justice, and environmental equity more generally. I'm curious to know, given you all work quite a bit with many different communities, was there a specific moment within this space around beauty justice, the beauty justice work, where community feedback sort of shifted the direction of the campaign? And how did you all kind of adjust there?
Yeah, thanks. I think that's a great question. The first thing that comes to my mind is the Beauty Inside Out survey that I kind of first talked about, where again, we conducted a survey to better understand how often people were using skin lightening products and chemical hair straighteners, and also why they were using them. There's a good amount of information and research out there about the harms of these products, but better understanding, how grave their impacts can be via how often people use them, and also, again, the reasoning why people use them, I think really gave us great direction in, again, kind of balancing the focuses of top-down versus bottom-up approaches, because, I think the results from that survey noting that the reason people use these products was other people's perception of them, and being able to get a job and be seen as beautiful by other people was the main driver for using them. I think, again, yeah, was pretty pivotal in how we thought about the approaches to this work. Danielle, do you have anything to add?
Yes, and I think that this Train the Trainer program was actually a very pivotal moment for us as a community-based organization, also working with other community-based organizations around the topic of beauty justice. This is one of our biggest projects where we actually did a Train the Trainer program, and I think that throughout the co-creation and feedback process were really big moments for us to learn about like cultural relevance and really making sure to adapt to each community, as again, all these different communities of color are not a monolith, so we can't, as we act for environmental justice that primarily serves Black and Latino communities, go into other neighborhoods and tell them what beauty justice is, because ultimately it looks very different in different communities. Obviously skin lighteners is a very is our common theme here, but how beauty standards and beauty justice experience in different communities is just very different. So this Train the Trainer program was something that we wanted to share with you all today, because it really gave us a lot of insight on community feedback and what we can do in the future to expand on this research.
Thank you.
Awesome. Yeah, thanks, Keith. Are there any other questions people have right now? Oh, I see. Was there any community compensation for surveys, learning sessions, and feedback, participants, trainers? Do you know off the top of your head, Danielle, about the Train the Trainer program?
I have to check up on that. The reason why info is not on the top of our heads is because they conducted this a few months before May and I started at WeAct. But I can definitely get back to you on that, what that looks like.
Yeah. So, but in the past, another example of something we've done is we conducted a product use survey that's informing our testing for formaldehyde that I mentioned earlier. And for that, we had this survey that kind of gave options for how often people use products that they leave on, that they rinse off, from hair products to lotion to makeup, everything. And those surveys were distributed at WeAct membership meetings. And I believe participants were compensated like with a $5 gift card. But, I think if you're able to compensate participants, it really does help increase how many people you can involve, because it's like partly an incentive thing, but also it can be hard depending on the time commitment for what you're asking of people. It can be difficult to if you're asking someone to volunteer a few hours of their day, that can be more difficult for some people than others. And compensation can make the difference between getting the participation and engagement you desire, and not.
Yeah, so I just checked really quick, checked myself. I was pretty sure that we did compensate folks because that is our practice. And yes, each CBO staff member was compensated for their time in the trainer program, and their presentations were given as like routine community meetings that they were having. And in terms of sharing this important information with healthcare providers, I don't believe we had the chance to do that, but we really hope to expand our outreach with partnering with community health clinics and local hospitals, which is something that we're already doing with the New York Attorney General Office with our pesticide reduction and awareness work, which is another toxics topic that we work on, but we haven't done that with BD Justice yet.
Yeah, and on that point, I'm dropping a couple more links in the chat because I kind of mentioned we work with a few state agencies regarding mercury and skin lightening products, being New York City, Minnesota, and California. And they have super great again, like they test a lot of these products and they have other great resources, not only for, you know, the people in their community, people using these products, but on these websites, you can also find examples of health alerts that are catered toward healthcare providers. So yeah, we know people who do that type of stuff, but we haven't gotten into it specifically. But again, they have really great examples of how they communicate these findings to the public. And I do have other resources if people are interested regarding like the chemicals and health outcomes of hair and nail salon workers. An example study about formaldehyde in personal care products, and a few reports talking about how race and income can affect people's risks to harms in personal care products due to marketing. So if anyone's interested in any of that, just type it in and I'll drop everything. Don't want to overwhelm you all especially if you already know this type of thing. But awesome. Yeah, so these are, again, reports from that weren't conducted by WeAct, but just some partners in this field. Sources. And I can also send these to Michaela about so you can get like an email about them afterward, maybe.
So we can finish up with the last two slides of our presentation just very briefly in the last 10 minutes. And anyone else who has questions, just please drop them in the chat as we go along. But right now we are conducting community-driven in-store monitoring where we hope to recruit community members to help us with data collection. We're partnering with Clearia, a mobile application that scans for toxic ingredients and provides non-toxic alternatives to different beauty and personal care products while you're shopping in stores. So we'll be working with them as they've developed a research extension app to scan basically products in our stores and then see what we find in terms of toxic ingredients, and we'll be looking at non-chain, more of mom and pop local community stores that aren't big brands. So we're really interested in seeing what we find, and if anyone's in the New York City area and would like to help us with this community-driven data collection process, please feel free to reach out.
Yeah, and we're working on recruiting people in the New York City area to do this, as the products someone may choose in the store. That's what we want to be reflected in the products we're incorporating in this data set. So we're very excited about this. We'll also be looking at the racialization of these products and how you know, they might differ in who they're marketing toward based on photos on the packaging, language on the packaging, etc. And then our last little slide is just about this convening I had mentioned, where in August we brought together experts on the topics of mercury in skin lightening products and dental amalgam. And it was a very informative and fruitful convening. And these kind of action items I've listed here, we're putting in a report that can also be sent out to you all once it's finished, but it really thoroughly outlines the regulation and enforcement around these two product areas, research that's going on now, and how we can improve all of those things, in addition to how community intervention is not only essential to educate communities and decrease demand for these products, but also, yeah, just working from that bottom up framework. So, yeah, I think those are our slides.